I don't know what I have. Yeah, I mean, they have it. They have it.
I
So
was just gonna tell you to log in on your other computer just in
that's
case.
what, yeah, that's what I was gonna, do. They have it. I don't have it. So I'm assuming that.
Good evening, Mr. Robbins. Good evening, my friend, Congresswoman Dingle.
Good evening. How are you?
Hi, guys. I'm putting you on mute.
Good, good. How are you? I think everybody can hear us. We're just waiting for the governor and the lieutenant governor and Dr. Khaldun. Good evening, Dr. Khaldun.
Good evening. How are you?
Good, good. How are you? Good to see you.
Yes, good to see you as well.
Well, Congresswoman Dingle is a brave soul to have the U of M stadium is in her background there.
Hey, go blue. It's,
Yeah. Yeah,
it's my district.
I get that part.
Let's get that out of the way before the governor joins. She's a state fan. Go blue.
Hey, we know that, but she knows. And by the way, I lost my bet to her when we played Michigan State. We do terrible every week. I don't know who's worse, the Lions or, but I'm a loyal fan of whoever I'm a fan of.
I'm a loyal fan too of the Pittsburgh Steelers.
You are a smarter man. Hey, do you know how Benny's doing, Warren?
Not well, not well. They're concerned about maybe dialysis now, is having some kidney function.
Oh, God.
Leave it here with us, but
Yeah, I won't say anything. I stayed home last week, I'll tell you. I actually listened to the governor.
yeah. I've been listening since March. It gets kind of claustrophobic at times, but
No.
but I get it.
Well, I admit that during the summer I was outside. I did not stay inside.
Just want to remind you, we are live on Facebook, so be careful what you say about Michigan State. Good evening, Lieutenant Governor.
Yeah, why should we be careful about Michigan State?
I don't know.
Hey, Garland's on my side. He likes my boy.
Folks, few more minutes. We're just a few more seconds. I guess we're just waiting on the governor.
Gita did text to say you guys are live and we can hear. But I don't care who hears me. I'm a loyal Go Blue and Lions fan.
Yeah, go blue. I don't know about the Lions.
There is something to be said for loyalty, not much, but something, I guess.
Hopefully the Lions can bring a Dearborn native back to Detroit to coach their team, Robert Saleh.
Yeah, he'd be a good choice.
Yes, he would be. Okay, folks, good evening. I think we're going to start. The governor is running a few minutes late, and we have the lieutenant governor who will lead us off. Good evening, ladies and gentlemen. My name is Sam Beydoun, and I proudly serve the residents of Allen Park and Dearborn on the Wayne County Commission. This year, we were blindsided by the coronavirus pandemic, which has affected the lives of millions around the world. Unfortunately, this pandemic is not over yet. So we must continue to do everything we can to keep our families and our communities safe. Tonight, we are joined by Governor Gretchen Whitmer, Lieutenant Governor Garland Gilchrist, Chief Medical Executive Dr. Janae Caldoun, Congresswoman Debbie Dingell, and Wayne County Executive Warren Evans to discuss the ongoing pandemic and efforts taken on the federal, state, and county level to help slow the spread and bring relief to all Michiganders. We will also be focusing on small business relief and what you can expect in the next coming weeks with the 2 vaccines coming out. We continue to send our prayers and well wishes to all those affected by COVID-19 around our nation and around the world. Our thoughts and prayers tonight are with you and with our brave and dedicated Wayne County Sheriff, Benny Napoleon, who is fighting his battle with COVID-19. I wanted to take a moment to thank each and every one of our special guests tonight for taking the time to speak to us. And I would also like to thank all of them for their hard work and leadership over the last 9 months. I would like to especially thank our governor for her leadership despite the hateful rhetoric, attacks, and actions taken against her and her team. She has and continues to save the lives of thousands of Michiganders, and for that, we thank her. She is a resilient leader, and I am thankful that she is leading us in this fight against COVID-19 here in Michigan. The nomination by Time Magazine for Person of the Year is a testament of her work and leadership. Governor Whitmer is running a little bit late and will join us. I would like to turn it over to Lieutenant Governor Gilchrist. Lieutenant Governor, the floor is yours with an opening statement, and we have a few questions. And thank you again all for being with us tonight.
Thank you, Commissioner Beydoun, and good evening to everyone who is joining us from Wayne County. This is Lieutenant Governor Garland Gilchrist, a proud Wayne County resident. Happy to be here alongside Governor Whitmer, Dr. Caldoun, Congresswoman Dingell, County Executive Evans, and the many other leaders who I know are joining this call. I want to thank the Commission for putting together this event and for doing this whole Teletown Hall series. This is the essence of keeping people informed about what their government is doing with and on behalf of the residents who we all serve. This is really a critical time, everyone, for Michiganders, and frankly, for the entire country and the entire world. We have to come together to deal with this COVID-19 pandemic. This means everyone has to do their part individually. You got to mask up, continue to be masked up. We have to continue to practice safe physical distancing. We have to continue to wash our hands. We have to continue to do our best to follow those public health guidelines that have been given down from the experts. And we have access to some of the best experts in the world here in the state of Michigan about giving us guidance for what we need to do to stay safe. Specifically, I want to talk about the fact that, we have made progress in Michigan when we have listened to the advice of experts. And when it comes to the overall impact of the pandemic in terms of the rates of cases and things like that. So as we've seen them tick up in the fall, we took some action to try to, again, follow that public health advice to try to get our case rates, our positivity rates, our mortality to slow those down while they've been growing all over the country. We also have followed the expertise of so many people in Michigan, some of the greatest minds trying to tackle racial disparities in this pandemic. We already know that generations of racial disparities and inequities have existed and had a detrimental impact on people of color across the nation and across our state and across Wayne County. COVID-19 has done this in a way that nothing has in any of our lifetimes has made such a bright light on these challenges. Every metric, every data point, every case, every hospitalization, every death, is a person. And we have to remember that. Many of us who are on this call, I know, have had loved ones or friends or colleagues and coworkers who have been impacted, who have been infected, who may have been in the hospital, may be in the hospital. Prayers are with Sheriff Napoleon. also who have been killed by this virus. I have 24 people in my life who that's happened for. But when we're talking about racial disparities, we've seen that early on in the pandemic, you know, Black folks, to use an example, we make up 13.6% of the population. Yet in the beginning, the first 2 months of the pandemic in March and April, we accounted for almost 40% of the people who passed away. But thanks to the leadership shown here in Michigan, Governor Whitmer, via executive order, creating the Michigan Coronavirus Task Force on Racial Disparities and asking me to chair that task force, we decided that we were going to get to work, and we were going to be the state that was going to protect our people in this sense as well, by working together, bringing some of the best minds in the state together to try to limit the mortality rate disparities that we've seen in COVID-19 and try to prevent people who are vulnerable from getting infected in the first place. And we have done that. The task force, we really tried to accomplish two goals. One is to reduce that mortality rate disparity. And the second is to really connect to the longer term work that needs to be done to address disparities in health outcomes. And so in the early stages of the pandemic, we have done things like giving out free masks, more than 6 million masks to people across the state, including 2 million masks for children. We've had specific communication strategies that have focused on communities of color, making sure that we know what we need to do in order to keep ourselves safe, our families safe, our neighborhoods safe, and our communities safe. We have provided grants to initiatives in Wayne County and across the state of Michigan that are putting in place specific rapid response interventions using federal dollars to make everything available to people, from PPE to testing capacity to helping students who have special needs and who are distance learning and haven't been able to be fully served because it hasn't been safe. And we've made significant progress. I'm happy to report, and we're actually going to be sharing some more information about this later this week, that we have been able to thus far make real impact on reducing racial disparities. That Black folks, to give you the comparison from that early stat, have gone from 40% of the deaths to less than 10%, from 38% of the infections to less than 8%. That's because the people of Michigan, Black folks in communities of color and in Wayne County and other parts of the state have done their part. And we're just asking that people continue to stay vigilant. We know this pandemic isn't over. We do have some bright and hopeful opportunities on the horizons with these vaccines, but we have work to do to make sure that people are able to trust the vaccines, that we are able to distribute them to the people who need it most. So we're going to continue to need to work in coordination and partnership at every level of government, in every phase of our society, whether it is the public sector, the private sector, the philanthropic sector, the nonprofit sector, educational sectors. We all must come together to address the biggest challenge of our time, how it impacts us from a public health perspective, how it impacts us from an educational perspective, and how it impacts us from an economic perspective. What I do know is this: when we come together, when we stand strong and tall together, we can overcome anything that's in front of us. And so I'm confident that with the people who are represented here in this call working together, we will be able to get to the other side of this in a way that keeps people safe, that creates opportunity for prosperity, and that allows us all to move forward together. So thank you, Commissioner. And did you want to go to questions first, or can I kick it over to Dr. Khaldun?
Yes, I'm going to go to questions. And thank you, Lieutenant Governor Gilchrist. You basically answered my first question about racial disparities. You really offered in-depth analysis on this subject. I would like to go to Dr. Khaldun. Dr. Khaldun, what can you tell us about the trend with COVID-19 cases throughout Michigan, and what do you predict we will see within the next coming weeks, especially with the holiday seasons upon us?
First of all, just thank you, Commissioner, for having me on the call today. It's just an honor to be here with all these great Michigan leaders, of course. So, I know people have been paying attention for several weeks. Unfortunately, we are in the middle of that fall surge, that dreaded fall surge that we talked about a lot across the country over the summer. Unfortunately, we are seeing a significant surge in cases that has been going up since September. And it's been across the entire state. And that's something that's different than what we saw in the spring, where we saw the bulk of the cases really concentrated in Southeast Michigan. And I know people on the town hall today really understand that quite well. So we've seen an increase in cases, we've seen an increase in test positivity. So that means of all the people who got a test, how many of them, what percentage of them are coming back positive. And so when you have sufficient testing, like we do in the state, over 60,000 tests today, and you have your percent positivity going up, whereas it was around 3% over the summer, and now it's at about 13%, that's cause for concern. And we have seen significant community spread across the state. As you all know, a couple of weeks ago, and DHHS issued an order to really, in a targeted manner, address some of the highest risk things when it comes to spreading COVID-19. So indoor gatherings, restaurants and bars, things that we know nationally are at highest risk for spreading the disease. And so what we've seen, I've got some good news, is that over the past week or so, we actually have seen a little bit of a decline across the state when it comes to cases. And I think, again, that just goes back to Michiganders, by and large, doing the right thing, wearing masks. I think that everyone wants to see us kind of come to the other side of this pandemic with as few deaths as possible. And so while it's very preliminary and we are cautiously optimistic, we've seen just a slight decrease in the case rates across the state, only looking at the past week. I'll caution you and say that we know that some people may have made a decision to gather over the Thanksgiving holiday. And so if people did gather and coronavirus did spread, like myself and other experts across the country think it potentially will, we won't see some of those cases until another week or two after Thanksgiving. So it's still too early to say exactly what the impact of Thanksgiving has been. If I can just add, I think, I was talking to a national expert a couple of weeks ago, and one thing they said was, this is the last great battle of COVID-19. And I know it's been an incredibly long year, but as Lieutenant Governor said, vaccines are on the way. 2021 is going to be a much better year than 2020 was. All we have to do now is just kind of hunker down, wear our masks, maintain our distance, and good things are coming. I suspect that this time next year, we will be in a very different stance. A lot of people will have a vaccine. I expect our schools to be open, fewer outbreaks. I mean, we're getting there. So the best thing we can do now is just all, again, maintain our guard, not let our guard down, and do the right thing.
Thank you, Dr. Khaldun. Lieutenant Governor Gilchrist, I'm going to come back to you, and then I'm going to go to Congresswoman Dingell, and then County Executive Mr. Evans. Now that the restrictions are put in place, how has the state been cooperating with local law enforcement to enforce the rules that are in place, Lieutenant Governor?
Yeah, thank you, Commissioner, for that question. This is something that we get a lot, and just to take a step back, I mean, in terms of how we're thinking about enforcement, we have asked people to step up and be responsible for themselves and for one another, first and foremost. We didn't put the public health order in place so that we could go and give people tickets. We put it in place so that people could be safe and do what they needed to do and know what needed to happen and what was very risky to happen. And that's why we tried to limit it. We have been in conversation, and I'm proud that, in Wayne County, certainly, we have had cooperation for the most part with law enforcement in terms of working with us to make sure that everyone knows what the order says and what it means, and what the ramifications are of not following it. We've had more trouble, frankly, when we've gotten outside of Wayne County and in other parts of the state, particularly some of our friends up north. So that is an ongoing conversation. But really, enforcement comes down to people making choices. I mean, if you are, look, as a recovering entrepreneur, I would hate to be the business owner who, because I made the choice to actively and openly defy the advice of public health experts, to create an environment where people on my team or on my staff or in my family or my customers contracted the coronavirus. And then if I was a place that was a source of spread in a community that could lead to people being hospitalized, having long-term health impacts, or passing away, that's what we need to think about, is the role that we play in keeping our communities safe. And obviously, local governments and law enforcement have a role to play in that. And we would hope that all those public servants who are in law enforcement would take that responsibility seriously and recognize that it is not a political decision to keep someone alive. It's not a political decision to follow these experts who have given this advice, including Dr. Khaldun, who have made it clear, what's risky and what's more or less risky. And so we're hoping that people will band together because, as she said, we can see where this is going. We can see where we need to get. We have to get there. And in order to get there, we have to work together and we have to hold one another close and accountable for that. And so I would hope that we would look to our higher responsibilities in that regard and not merely think about, who's going to get a ticket or the police don't come somewhere. I think we need to be bigger than that and think bigger than that.
Thank you, Lieutenant Governor. Congresswoman Dingle, Congress passed a historic $2 trillion bill in March known as the CARES Act that included funding for the Paycheck Protection Program, enhanced unemployment benefits, and $1,200 direct payments to most U.S. workers. Congresswoman Dingle, you have continued to push on the Senate to act and help struggling Americans. What sort of relief can we expect from the federal government?
Well, first of all, Commissioner Baidoon, thank you for hosting this. And it's a real honor to be here with the Lieutenant Governor. Dr. Calhoun, you're doing so much to help so many. I thank you. And I'm very proud to work with County Executive Evans every single week as we try to take care of the communities in Wayne County. And he has been staying very close to the local elected officials. Look, you can't be home talking to people and not know how desperate people are. From people who have lost their job or have been put on, if you're a restaurant worker or a small business owner, they need help and they need unemployment. And the large unemployment checks, they weren't that large, but they were larger than they are now that the state then put in place are not there. And people are desperate, especially as we go into the holidays. I hear from my small business owners, my restaurant owners, all of us do, who are scared to death. We have passed 2 bills in the House since we did the initial 2 packages, and we need to do something. And quite frankly, President-elect Joe Biden has spoke to both Nancy Pelosi and to Chuck Schumer and said, we can't wait until January 20th. We need to do something now. State and local governments are also very desperate for aid. We need more money for testing and tracing for the state. We need more money in PPP loans. The restaurants, there is a restaurant bill that's actually been included in the House bill that would help our smaller independent restaurants. I don't know what's going to happen. I used to say every week, I have a meeting with my mayors every Monday, and then Executive Evans has one with the broader group on Tuesdays. And I used to say, we have no choice. We have to get this passed. Well, I still think we have no choice because people are desperate, and that's our job to do something. We're back in Washington. I think a lot of Republican senators will have been home and have heard from their people. The surge that we are seeing is, while Michigan was hit hard, is something that's being seen in states across the country. And community after community is experiencing much of what Michigan has, though quite frankly, we are very lucky to have the leadership that we do. And while some people have gotten angry at some of the steps that have been taken, it has saved lives. It is saving lives. And we want to help people in their businesses. We want to help people not worry about how they're going to eat, whether they can afford their rent, their mortgages. We want to give assistance to all of that. How it comes, the federal government, the budget expires on December 11th. So we're going to have to fund the government as well. We may put provisions on that bill that will extend some of the programs that are scheduled to expire at the end of December too. Will Rogers used to say people with weak stomachs shouldn't watch laws or sausage being made. I'm hoping that this is one of those times that those weak stomachs shouldn't watch it, but we're going to get something done because you all need it. You're demanding it of us. And I'm not coming home, and I plan on getting the hell out of here as soon as I can, but I'm not leaving until we do something. So stay tuned. We are been told to not go home this weekend. We're going to work over the weekend. We're going to potentially have votes. So there are many of us that are really dedicated to trying to get relief for Governor Whitmer and the rest of the team.
Thank you, Congresswoman Dingell. Executive Evans, thank you for joining us again. One of the areas where Wayne County has been a leader during this pandemic is in the assistance it has made available for small businesses. County Executive Evans, can you tell us about what the county is doing to help local businesses?
I can, I'll be happy to, but let me just reiterate for a second what the Lieutenant Governor said and Dr. Calduna. I think one of the realities that we see in Wayne County is what's commonly being referred to now as COVID fatigue. People getting to the point that, you know, I'm going to bend the rules now because it's been 8 or 9 months and a vaccine is coming and, you know, things will get better. We have to get to the vaccine point, as they both indicated. And this is the time when you ought to step it up and be more restrictive than you were before. It's tough, but it's going to get better, but it'll only get better if we follow the rules and the courage that the governor's had to this point. Specifically with Wayne County, I mean, we've looked around and said one of the significant problems, obviously, that we all understand is small businesses. How do they survive this pandemic? They are the folks, I mean, we try in government not to be short-sighted and figure that revenue that came from CARES was needed to cover our expenses. The reality is, you know, there are expenses that it's covered for us, but one of the bigger problems is if we don't protect our businesses and don't help keep them alive, we don't have any future. They are the backbone of Wayne County, and I say to anybody who would ever listen that, you know, Wayne County is the most diverse county, and the diversity is our strength. And so there are lots of mom and pop businesses. I'm not talking about huge businesses at this point. So we've been able to divert into the community a total of $70 million in assistance. And we're very, very proud of that. About 51 million has gone to the Wayne County Back to Work program, which put grants in the hands relatively quickly of a number of businesses in Wayne County. Over 5,100 businesses have shared that money. And this money is going to businesses that are hardest hit. And I'm especially proud of that. About 2,500, more than 2,500 minority-owned businesses, almost 2,000 women-owned businesses, and 137 veteran-owned businesses. I mean, we have put money in places where we know that money is critical to those folks being able to stay afloat. We worked with the city of Detroit to use some state dollar grant. Thank you, Governor. There was about $15 million shared between Detroit and Wayne County that was split for economic development purposes, and it's helped about 1,400 Wayne County small businesses. And we had a program with TCF Bank early on that we turned around very quickly to get low interest loans to people, to businesses in the community. So we think we've done that forcefully, and we are still working on some grants for nonprofits and religious organizations that we know have spent an awful lot of time this year working on COVID-related grief relief and a number of other food help, a number of things. And, you know, we all know their revenue's been down significantly. Churches haven't been open and in operation. So we work very, very hard to try to do that. And we're proud of what we've done. But I'm also proud of the whole team in the state of Michigan and how closely we've worked together with, I think, a singular purpose, which is protect the people in Michigan. And as much as businesses hate to be closed down for periods of time, it is hard for me to consciously make a decision to support a business when I know that, critically speaking, we have the lives of people on the other hand. So it's a serious blend, and we worked at it as hard as we can, but I think we've been able to do a significant amount in terms of relief.
Thank you, Mr. Evans. My good friend, Governor Whitmer, thank you for joining us. And I know you have another commitment, and without any further ado, the floor is yours if you would like to make a statement before we ask you a couple questions, Governor.
Sure, Commissioner, I apologize. I was a few minutes late. That's just kind of how this day has been. So thank you for your patience with me and appreciate your leadership, Commissioner. And obviously the County Executive Warren Evans has been just such an important leader throughout this, and Congresswoman Dingell, my right-hand woman, Dr. Janae Caldoun, and of course, my right-hand man, the Lieutenant Governor Garland Gilchrist. I think that this is a really important recognition that it really is the federal government, the state government, local government, county government, all working together. It's so critical that we remember that our enemy is a virus. It's never our one another or fellow Americans. It's a virus, and it has to be all hands on deck. And so I want to thank everyone who's joined this town hall, and Commissioner Baydoun, thank you for doing these town halls. I think the public so craves information. And in this moment, it's really important. We're in the midst of our 3-week pause. I know that Dr. Caldoun has probably spoken a bit about it, as has the Lieutenant Governor, and certainly my partner in the federal government and in Wayne County government. You know, we're taking steps to follow the public health expertise, doing the things that we know we need to do to avoid overwhelming our hospitals and seeing incredible death counts like we saw in the spring. This virus is still a very real threat to us all. It is an incredibly dangerous moment as we are in the midst of holidays, and as the county exec talked about, the fatigue that we're all feeling. But if we can double down on what we know works in this next 2 months, we will save lives, and we will be in a much stronger position as vaccines come available. And more of us will be able to get a vaccine if we can avoid spreading the virus right now. So that's all in terms of my opening remarks, but I'm just so grateful to be here with all of you.
Thank you, Governor Whitmer. Under the restrictions that have been put in place under the Department of Health and Human Services, how do you believe these will affect the lives of Michiganders and help us end the spread of COVID throughout Michigan?
Well, it's a fact that following the recommendations of health experts will help us save lives and protect our families, our frontline workers, and small businesses as well. You know, we beat this virus in the spring by listening to our health experts, and we can do it again. But it takes all of us working together, and that means wearing a mask. We know that mask wearing is proven to lower the risk of transmitting COVID-19 by 70%. Washing our hands and not gathering with people with whom, you know, they aren't our housemates. These are simple steps that public health experts are telling us are still the best tool we have to keep COVID from spreading. We also need the federal government to step up. Congresswoman Dingell is a part of a House that passed historic support for states and for frontline workers, and getting the United States Senate and the current president to move forward on that is absolutely essential. I'm hopeful, I'm prayerful, I'm mindful of how critical it is that they find some common ground before an extended break at the end of the year, because we have people who literally can't put food on the table and need a little bit of help to get through this time. And I want to thank Congresswoman Dingell for the vote that she took and the leadership she's taken on to help us get it done. But we have to meet the needs of people that are struggling the most. And that's what we really need out of the federal government to help us get through this tough time.
Governor, many small business owners are concerned that the restrictions that were put in place will affect their businesses. These are businesses that they have been working many years to build, some even generations. What can you tell us tonight to help put the worries of the small business owners to rest? And what is the state doing to bring relief to these small business owners?
Well, so, you know, my team and I have been working around the clock to help small businesses. I know this is the lifeblood of our economy. I have so many friends who have spent their whole life building their small business, and I know how precarious this moment is for so many. You know, the Michigan Small Business Relief Program awarded $10 million in grants and nearly $10 million in loans to small businesses in all 83 counties. More than 2,700 small businesses were awarded grants through the program. In Wayne County, as the county exec Warren Evans was mentioning, we've done a lot of grants in Wayne County and working with the county leadership, 157 in Wayne County, 123 in Macomb, 65 in Washtenaw, almost 800 in Oakland, who's provided a matching grant. And so they've been able to actually grow that fund, but we've got much more to do. So our Michigan Small Business Restart grants put $100 million in federal funding for small business relief grants. So I should thank Congresswoman Dingell for that help. But we've been able to put it right into small businesses and focusing on minority-owned businesses, women-owned businesses, and veteran-owned businesses. So, you know, I know that I'm repeating myself, but another stimulus to help us get through the next few months, which is going to be incredibly challenging, would put us in a position to do even more on behalf of so many small businesses that are just struggling to get through the next couple of months. And that's, once again, what I'm hoping we can get through the Congress. But also here at the state level, I've asked legislative leadership to pass a $100 million COVID relief plan. It's crucial that we come together and get this done, but we're focused on small businesses that have been hit hardest by this pandemic would be slated for assistance through that relief plan. So encourage your legislator in the House and Senate to take that vote and get it done so we can get some more help to small business.
Thank you, Governor. I'm going to go back to Dr. Khaldun because a lot of people, they're concerned about the vaccine and the availability. Can you give us an update, Dr. Khaldun, on the vaccine, and what do you believe we will see after the vaccine is out and distributed to Michiganders? And how has the state been preparing to distribute the vaccine once it's available?
Yeah, absolutely. Again, we are all anxiously awaiting the day when the vaccine will be made available to the state. We're following very closely, working with the CDC, our federal partners, to understand more about how the vaccine will be allocated, and at the same time preparing for distribution. So right now, there are two kind of front-runner vaccines that have submitted their request, their application to the FDA to be approved for emergency use to fight this response. And so that's one by Pfizer and the other one by Moderna. We expect, hopefully, if all things go according to what the federal government has been telling us, we hope that by mid-December, the CDC, the FDA will kind of grant this approval, and then we'll be able to start distributing the vaccine across the state. We still don't know how many vaccines will be available immediately. We do know it will be a small allocation, and we will have to prioritize in the beginning only according to those who are probably healthcare workers, so those who are working on the front lines, whether it's in emergency departments, general medical floors, EMS, ICUs, of course, so we'll be prioritizing there. We'll also be prioritizing those who are living in our most vulnerable settings. So for example, people who are working or living in nursing home settings. So that's how we will start to distribute the vaccine. It will take some time, and it depends again on production at the federal level, at the manufacturer level. But we expect that hopefully by the spring, probably mid to late spring, we'll start seeing the vaccine become more available for the general population. And so that's when we really will hope that everyone will be able to get access to this vaccine. Again, we're following the data and the science. Before the vaccine is approved, it has to go through a committee process, which is happening right now. And so we'll be following very closely with what the CDC and the advisory committee on immunization practices to the CDC is saying. And we'll be following the guidance and making sure we're distributing the vaccine accordingly across the state.
Thank you, Dr. Khaldun. I want to go back to the Lieutenant Governor. Lieutenant Governor, do you want to add anything as far as the relief being offered to the businesses in Wayne County and throughout the state of Michigan that are affected by COVID-19?
I think a lot of it's been covered, Commissioner, but I just want to reiterate that This is a critical part of how we are thinking about the response. We have to be, comprehensive when we're considering all of the avenues for relief in response to this pandemic. And so our administration has prioritized this from the beginning. I've been working specifically as well as on making sure that businesses that do have a path to stay open for their workers who are doing life-sustaining work to be able to have the equipment they need to be able to work, the PPE and things like that. The Michigan Economic Development Corporation really sort of restructured the Pure Michigan Business Connect program, which is a supplier connection program to connect typically, auto suppliers with tier 1s and tier 2s. It was basically transformed to connect PPE manufacturers in Michigan with businesses that needed personal protective equipment. And so we tried to do that and make sure that those resources and connections are available to folks, as well as trying to fill that supply chain with Michigan-based companies. And many of those companies that have been able to step into those roles have been companies that have been run by non-white entrepreneurs, and that's a testament to the ingenuity of the entrepreneurs that we have across the state and in Wayne County and in the city of Detroit. So we're very proud of that leadership and want to continue it. And I guess the last thing is that we also recognize that again, connected to this challenge with businesses is the challenges that families are facing in terms of their children and what their children are able to do, how they're able to learn or not able to learn. In person. And this is something that we also are continuing to prioritize and work with local leadership to find the best path forward.
Thank you again, Lieutenant Governor. Congresswoman Dingell, in your opinion, do you believe a deal will be reached by the end of the year in terms of the stimulus bill?
I don't know. I think that there are a lot of us that are working towards it. I think that the president-elect has said that it is a priority. It's very difficult to predict what the man in the White House will do, but I think there are a lot of people that are going to work towards trying to get something.
Thank you. Thank you again. And I want to go to County Executive, Mr. Evans. I know one of your top priorities has been increasing COVID testing throughout our county. Can you talk to us about what that program is doing, Mr. Evans?
Yes, I mean, we have worked, and by the way, Sam, I guess I see you so much and I talk to you all the time. I didn't really mention how important the commission is to what we get done. And thank you for having this this town hall. I think it's critical. Yeah, I mean, and if you tie this to business a little bit, businesses also have to understand that what we do in increasing testing and those other things are also designed to try to help stem the increase in the virus so that businesses can reopen. I mean, all of these things are not mutually exclusive. There's some connectivity between them. But yes, we have worked very hard to open up sites. We've contracted with Garden City Hospital. We have a number of different testing sites that we've set up for different weekends, periods throughout the county to try to cut down on the drive time for a number of people. I have to really thank the mayor of the city of Detroit early on for opening up his testing sites at the old State Fairgrounds for us. We've really worked at that, and we're working forward from there, Sam, to make sure that we continue to do it. I mean, we're in the process of getting mobile units that will be able to go out to different areas, and we can advertise to go out. So not all just the fixed sites, because most of the fixed sites that we've had, quite frankly, have gotten to the point where the lines get so long. If we're still going to get people to come, we've got to flip some of that off to other sites. And so we're definitely working on that. And Sam, we're also getting ready for the vaccine. I mean, one of the vaccines, there's a vaccine that has to be kept at a very, very low temperature, and that's something our refrigerators and freezers can handle. So in order to be prepared in time, if that's one of those that's released, trust us, we will be ahead of that in terms of having the supplies we need at that time.
Mr. Evans is one of the 15 commissioners in Wayne County I know very well what the administration of Mr. Evans has been doing, and we thank you again for everything that you have been doing. Before we wrap up, I'd like to go back to Lieutenant Governor. Any closing remarks before we wrap up? What would you like to, what's the message to Michiganders today that are watching us?
Well, thank you, Commissioner, again for this forum. I think there are two messages that I'd like to deliver. The first is the message of gratitude and encouragement. You know, look, in Wayne County, people have stepped up. People have worked to take care of one another, have worked to do, you know, what we needed to do to get ahead of this thing that none of us understood when it came at us. And it hit us hard. We learned fast, and we were there for one another. And that's really, you know, it brought out the best in us as a collective, honestly, to be able to be that unselfish. And so my first message is one of gratitude for that. And the second is one of vigilance. Again, we can see where we need to go. We can see the mountaintop. We can see the promised land, which is the other side of this pandemic. We can see it. We can reach it. We have to stick with it. We have to stick together. And I know that we can. Just because something is difficult does not mean that it is not possible. We prove that basically every day as people from Michigan. And this time, I know that we have the capacity to do that. So we just got to continue to stick with it. We have to be vigilant. We have to continue to think beyond our individual selves and the temporary, inconvenience or the temporary discomfort, to think about the best possible outcomes for our communities, for our families, and for ourselves and our children. So I know we're capable of it. We're big enough to do it. And so let's just do it together, y'all. Thank you for stepping up.
Thank you, Dr. Khaldun. Besides wearing a mask, which is something very important for many of us, what are your final words to all the residents of Michigan?
Yeah, I would just echo what Lieutenant Governor Garland Gilchrist just said. I mean, I'm incredibly proud to be a Michigander. I mean, I know we've seen case rates go up, but I also know there are a lot of people out there who are doing the right thing. They're wearing their masks, they're washing their hands, and they're not gathering in groups. And I'm proud to be a Michigander. We brought that curve down in the spring, and I'm confident we can do it again. As Lieutenant Governor said, we just have to remain vigilant. It's washing hands. It's not gathering in groups. And it's not just gathering in groups with people who are at a school or at some type of sports function. Even anyone who lives outside of your household, even if they're family members, it can be tough, but you got to tell your elderly parents or grandparents that you can't visit right now. That's just kind of how it is, unfortunately, right now till we get to the other side. But I'm incredibly confident that the vaccine is going to come out. We will get it into arms next year, and we will be in a much better place at this time next year. So everyone just stay the course.
Thank you, Dr. Khaldun. Congresswoman Dingell, your final thoughts to our residents in the 12th and throughout Wayne County and the state of Michigan.
I know that everybody's feeling COVID fatigued. We're tired of it. We're feeling stressed out. We miss our friends. I mean, nobody would ever have thought Debbie Dingell could stay inside. I mean, look at the look on Garland's face. I'm a people person, and yet that's what we have to do. And it's going to take a few more months. We've got to listen to the experts. We've got to listen to the scientists. I was sort of struck by how all the lead doctors this weekend, Deborah Birx, who leads President Trump's COVID task force, Tony Fauci, the Surgeon General, all said, these next few weeks and months, we're going to have a surge on top of the surge. Our numbers went down because we've taken a pause in Michigan. So we want those numbers to keep going down. We find ways like this to talk to each other, connect with each other. I'm tired of all of you and looking at you in black dark boxes, but you know what? I can live with it a few more months because I want to live with you guys for a long time. So Warren Evans can see Michigan have a winning team again, and the Detroit Lions will have a good season. But we got to have hope right now for the future. So we got some, look, it's not going to be the best winter we've ever had in some ways, but hope is always there. And the vaccines are bringing us hope for a good summer next summer and a great football season next fall. forget this one.
Thank you, Doc. Thank you, Congresswoman Dingle. Before I turn it over to Mr. Evans, Dr. Khaldun, someone messaged me while we're talking during the town hall. A quick question: is it true, or what's the truth to the fact that children under the age of 12 will not be vaccinated? Can you elaborate on this?
Yeah, so we're limited by the vaccine and how the vaccine has been studied. So that's right. Right now, the vaccine has not been studied in children. So when it becomes available, I don't expect it to be available for children. And then that's just these first initial vaccines. There are many more in the pipeline, more research and studies that have to be done. But right now, we will be focusing on vaccinating adults in the state.
Thank you, Dr. Khaldun. Mr. Evans, your final thoughts for Wayne County residents?
Well, first, let me take my shot at Congresswoman Dingle, and we'll have the virus handled way before Michigan football gets itself together.
I'm afraid of that.
To Wayne County residents, one of the things that you can really do to help us going forward is, and we have a program this winter. It's called Shop Small Wayne County Businesses. We're into, the holidays are here. We're all going to do shopping, whether it's online or differently. We're going to do those things, and to think about, when we're talking about the businesses that are suffering, they're going to suffer, and we can help some of that suffering by limiting our purchases and our spending on the holidays to our regional local businesses that are so key to our quality of life. So would really like to see that happen. I think we've covered so much today, but everybody has said essentially the same thing. We have to knuckle down. We have to remember it. I mean, we're way past the time of going around telling people what they need to do to stay safe. They know what they need to do. Now we need to continue to do it. And we almost have to up the tempo until the vaccine is available. But hopefully that will just be a couple of months away. And I just want to thank the citizens of Wayne County for being as strong as they've been so far. It's tough on everybody, but we're a resilient group, and I'm proud to lead Wayne County.
Thank you, Executive Evans. I would like to thank our honorable guests for joining us tonight and for all their hard work and dedication during this pandemic. As it was stated during this town hall, our fight against COVID-19 is not over. Please continue to wear a mask and practice social distancing. If you feel that you are sick, please quarantine and get tested. We must do everything that we can to help slow the spread of COVID-19 and defeat this invisible enemy. Thank you all and have a good night. Thank you.
Thank you.
Thank you, Commissioner.
Thank you.